Hi, my name is Christina and this is my drawing up insulin video. I would first verify the healthcare provider's orders. I would then verify the 6 rights of medication administration: right patient, right route, right dose, right time, right medication, right documentation. I would then check the order in the medication order in the EHR. I would then calculate the correct dose of medication that needs to be administered. This may be done, since it's insulin, could be done after their blood glucose is assessed. I would enter the patient's room, close the door for patient's privacy, wash my hands. Hi, Mr. Smith. My name is Christina. I'll be your nurse today. Can you please verify your name and date of birth? Check his wristband while he's verbally verifying for 2 verifications. Perfect. Mr. Smith, do you have any allergies to any medication, environment, or food? Perfect. So today the doctor did order some insulin. I will go over more in detail before I do administration. I would go ahead and start hand hygiene and apply a pair of clean gloves. So Mr. Smith, the doctor did order 4 units of regular insulin and 8 units of an intermediate acting insulin. If you were unaware, insulin is just a hormone that has helped to regulate blood glucose levels in diabetic patients. It helps the body move the glucose from the blood into the cells so they can use it for energy. A couple side effects I want to talk about are injection site pain, weight gain, and possible rash. A couple adverse effects would be headache, dizziness, or blurred vision. And Mr. Smith, if you experience any of these adverse effects, please let me know immediately. And also, you may experience a slight burning or stinging sensation at the injection site. It's pretty common. Do you have any questions for me, Mr. Smith, before we get started? Okay. An appropriate blood glucose level before a meal is usually between 80 to 130 milligrams per deciliters. So we took Mr. Smith's blood glucose level. It was 110, so I would give him his insulin, and then I would want to bring his breakfast tray within 30 minutes of that administration. So then I would go ahead and get the select the ordered insulin from the med cart, compare the insulin labels with the MAR, check the medication expiration date on the vial. Looks good. If the medication was refrigerated, I would need to allow it to come to room temperature before administering that. I would also need to inspect the insulin for any changes that may indicate a loss of potency, such as clumping, frosting, or altered color or perspiration on the vial. I would prep the medication by calculating the total volume of insulin needed. So today we were ordered 4 units of regular and 8 units of the NPH, so we'd add those together, which would be 12 units total volume. I would go ahead and have another RN verify my calculations before I actually started withdrawing that medication. I would then want to roll the vials in between my hands. This just helps resuspend the medication and also getting it to room temperature if it was refrigerated again. I'd want to make sure that the regular insulin was clear, and then the NPH is generally cloudy, so a little cloudiness is okay. I would want to open up some alcohol wipes and wipe the tops of each vial. I have a 1 milliliter syringe. I'd want to withdraw 8 units of air and push that into the NPH, making sure not to touch the needle to the actual medication when I disperse the air. So we'll go ahead and do that. Okay. I would then drop 4 units of air and put that into the regular insulin. Withdraw. And then on this time I would want to actually withdraw that 4 units of regular insulin. Okay. And I'd want to tap the air bubbles out. And then I would want to compare this regular insulin to the MAR again, making sure I had it correct. And everything looks good. So then I'd want to go ahead and check the vial to find that 12 unit, or not the vial, check the syringe to find that 12 units on it. And I did. And then I would check this combined dosage against the MAR again. Then I would want to place that needle back into the NPH vial and pull that 8 NPH. Okay. I want to make sure that we do not overdraw on this one. If we do, then we would have to start all over again. And everything looks good. Pull that out. We want to carefully recap. And then I'd want to go ahead and check that MAR one last time, making sure that, again, the 12 units is correct. I need to show you the 12 units. Oop. Okay. If we prepared the medication away from the patient, we would want to safely recap the syringe, label the syringe with the medication and the dosage, and then we would bring it over to our patient. After administration, I just want to remove my gloves, perform hand hygiene, and then document.